First of all, I would like to invite Dr. Kartikeya Sharma sir. He is a senior neurosurgeon, renowned neurosurgeon of Prayagraj. Dr. N.N. Gopal sir. He is professor, neurosurgeon in MLN Medical College, Prayagraj. Dr. Prabhat Singh, he is associate professor, neurophysician, MLN Medical College, Prayagraj. Dr. Shreyasi, he is consultant, child and adolescent psychiatrist at Allahabad Child Development Center, a multidisciplinary center for children's psychological, developmental and medical needs. I request one of the chairpersons to please invite and introduce our speaker, Dr. Shreyasi Vashishtha.
Everyone, Dr. Shreyasi Vashishtha is a clinical psychologist and counselor at IIT Kanpur, and she has got a good approach in the cognitive behavioral therapy, and this is one of the very good aspect in cases where the neuropsychological disorders are there. Instead of the drugs, the behavioral therapy is very useful, although we are not very accustomed to this, but I think that with this talk we will be enlightened and we will be addressing this issue very common when the she has got the expertise in the applying the mindfulness based therapeutic approaches. Instead of going for the introduction and all these things, I invite our speaker to enlighten us with this talk.
I have a small announcement. Dr. Alok Vajpayee was also supposed to be here. Because of ill health, he couldn't come. But the majority of the presentation was by Shreyasi, so she's over here. So the initial few slides, which Dr. Alok Vajpayee was supposed to take on the neurobiology, I'll just cover, and then Dr. Shreyasi is going to take over. As we've all mentioned, like today, internet addiction and gaming disorder has now been recognized by the American Psychiatric Association and by the DSM-5 as one of the disorders of like substance abuse. Initially, we used to just think that it is just an habit, but now the research, neuroscience has actually shown that prolonged use of internet and gaming, which you can all see, that is happening. Initially, we used to have a large laptop or a desktop. Now the things are becoming smaller, more convenient, and we are getting into it 24/7. This actually leads to disorders in our neurochemistry. Principally, in the gaming and internet disorders, the dopamine system, the endocannabinoids, which you call it as the natural opioids which are there, and serotonin and the norepinephrine pathway is involved. And initially, from salience, which we call it as importance, then it becomes an impulsive and finally a compulsive behavior. As we already mentioned, the APA has already included gaming disorders, and it is also there in the 11th edition of DSM. And not just the disorder per se, as Dr. Savita had just mentioned, that adult ADS comorbid with so many psychiatric disorders. Similarly, excessive use of internet and gaming disorders is so much associated with mood disorders, principally depression, suicidality, anxiety disorders, even psychotic symptoms. ADSD, as I mentioned, like is one of the very common conditions which is seen comorbid, and both lead to deterioration of the other condition. Impulse control disorders, bulimia nervosa, and substance dependence, especially alcohol and stimulants like cocaine and amphetamine, have been increasingly seen to be present in gaming and internet disorder. Now I welcome Dr. Shreyasi to take over.
Dr. Alok Vajpayee, since he could not be here. Okay, we start. So I am basically a clinical psychologist and I work in IIT Kanpur as a student counselor, and so basically the presentation is here from my experience of counseling with youth population. So internet, in my understanding now, it has become coming parallel in between, like similar to electricity now. We don't question electricity in the same way especially in the urban population, we are not used to question now internet now. But even despite having difficult problems with the internet in small population, the benefits of internet, they overshadow the small complications that come with it. In the urban society also, what has happened is that there is gap in humanity, like the connections between the people, like in the families, the joint family system hata and everything. So technology has seeped into these gaps. बहुत clearly technology has seeped in, like I can give an example. What happens in our campus is students, they don't call each other. It's considered somewhat rude to call. So like, why is considered rude to call? So it's like, when we are calling, we are putting the other person in jeopardy कि उसको phone उठाना पड़ेगा. So they don't, it's like you text. So texting is like, it's the normal norm by which the students operate, and they don't want other person to call, and when the call happens, so it is considered to be somewhere rude, close to coming by it. So internet addiction, basically it's a kind of a behavioral addiction, and there are definite other addictions which are part of the internet addiction. But now internet is a functional necessity, as I discussed. So when I discuss the subtypes of the internet addiction, I will use some case examples here, but I have prepared this slide very last minute. So anyway, I guess from the morning I've been talking to some people, and I'm hearing that you know the patients overread. Patients is somewhere you're that part of the internet where you guys are facing problem, where patients will come all sort of a knowledge. So that comes into the online research or information seeking part of the internet addiction. And in our college, this is like IIT Kanpur, like they say nobody is like not smart. So even students and the specialist doctors, everyone, and if Dr. Vajpayee would hear, he would have told that student will come with all sort of knowledge. They will come, this is there, give me this drug to the doctor, and the doctors definitely, they don't comply to it, but that's a problem. They can't teach these students because the students' cup is already full. Another example that I can give in online addiction, like net compulsions, means shopping and gaming. So shopping is again very common among the girls, like Mintra guy, he's there in the campus. I think so he lives in the campus, he's there everywhere. There are two Mintra guys, he will be like going here and there, delivering, standing in front of the hostel for hours, because the packet is this big. And then two guys are there with this big of packet, and then the girls are coming, and then girls are waiting, bhaiya hum aa rahe, and everything. So that shopping addiction is one of the very thing common. I can give another example of the gambling. I had just recently had a case. He's a PhD student himself, and he's a very tech savvy student. He did his bachelor's from some IIT, master's from some IIT. Now he's in IIT Kanpur doing PhD. So what he did was, like, there is a gambling में एक 3 पत्ती करके कोई game होता है. I'm not aware about it. So he says that ma'am, उसमें ऐसा होता है कि 3 आते हैं cards, and you have to predict which number will come based upon the 54 cards that are there on the deck. So what happens is he spent some money, like he has 3 credit cards, being a PhD student. So he spent like 100 money, and what is like, he lies on his bed, on his chest, the laptop is there, and like 100 rupees ka play kiya, and then the instant, whatever the algorithm comes, he noted down, next play kiya. So he spent around 50,000 of money to read the algorithm, and in that way he cracked the algorithm in a way like he was able to predict what next cards will be. So in that way he said, ma'am, it's very problematic also. He took months to learn that, because they say that कि वो गैम्बलिंग वाले जो ऑनलाइन गैम्बलिंग, वर्चुअल गैम्बलिंग वाले लोग हैं, वो लोग भी अपना एल्गोरिदम जल्दी चेंज करते रहते हैं. सो बट ही वॉज परसिस्टेंट, एंड not persistent in a good way, he was addicted, but he spent around 50,000 money to just learn the algorithm, and eventually he learned the algorithm. Then when his algorithm started working, उसने फिर 20,000 लगाया, that was the first investment, and उसको उसने thrice करके लगाया into 3. So what happened is, like, he earned 80,000 in one go, and eventually he earned money in lakhs. He helped his family build up a home. He also helped one of the friend to get his friend's sister get married, and the financial things were small. But by this time he was completely hooked with the online gambling. And currently, when the case was referred to us, when he was not opening the door, he was not talking to the parents, he was not having his meals, he was not taking bath, nothing. He was just in his room doing gambling, not sleeping, sleep deprived, food deprived. And we had to literally go there, bang the door, call parents. His parents came, everyone, and eventually he is in psychiatric care, and the case has been going on. Another case that I want to refer is about the, I guess the slides got shifted here. Another case that is like first year students basically. So for these first year students, when they come to the campus, the internet speed is very good in the campus. So what happens is that these students, they have been studying for JEE for last 3 years, 4 years, and eventually when they've got like no parent on the back, no one to supervise them, they are just using internet for any source, for Instagram, for YouTube, they read comics books, manga. It's very popular among students. It's a Japanese comic books, and they read this in a way that they stop going to classes, they don't talk to anyone, and these are the first year students. So eventually they have lot of academic loss, because whatever they lose in the first semester, it's very difficult because things get piled up, the courses get piled up, and they have to go through an enormous amount of stress to overcome that. Another kind of addiction, that is cyber sexual addiction, that is the case that I'm going to refer to. That's also very common in coming to be very common here, is that people are basically, it's the crime actually. What is happening is they will receive some request in Instagram, and then they will say yes to it, and eventually what happens that they will find that, okay, this is a group, some of the seniors are there, some students are there, let me join this group, what's the harm here? And then they are talking on the Instagram, and eventually what happens is some person contacts them from the group, and then they chat on WhatsApp, and then eventually it turns out to be a sexual chat and something. There is a girl, someone pretends to be a girl, they don't know that, and then they are talking to it, they are like, okay, then video call happens, and then what happens in the video call, as soon as, like, it's a 10-second game. So what happens in 10 seconds, aapne video on kiya, and then you are here, your face is there on the video, and the other person that's there on the video is someone, either male or female, but they are not wearing any clothes and everything, and they are in a promiscuous position. So what happens is that that's the 10-second they require, and after that they morph the videos, and then they send these videos to the Instagram. Okay, they prepare like full masturbatory videos and everyone, and then they ask the students, okay, give me 10,000 rupees. And after the 10,000 there has been cases where the student have ended up giving money. So we counsel these students, don't give up money, nothing bad would happen, and definitely legal procedures, and the police is involved, everything goes on. But the whole point I'm saying, this whole presentation, we are all here because of the internet and the benefits of it, but there are some shortcomings, and these shortcomings cannot be undetermined. So some of the examples of internet addiction. Coming to it, as Sir has identified, that internet usage is closely related to how we use drug. Like the neural pathways are similar, the dopamine hits we receive, they are similar. So the question comes is, how much is too much? Because I need internet, every one of us need internet. We do our professional works on a daily basis, we need internet, we communicate to friends and family on internet. How do we decide what's the barrier? And that's the point. That's the part where even the ICD and DSM and the research world is still questioning. Still, research is going on. How much is too much? That's the question that's coming up. So, till now, what we have, the research is restricted to is finding maladaptive behaviors. So that's what is going about, like reading ADHD also, like texting while driving, talking while driving. It's a cause of the major accidents that happens in the world, all around the world. So other maladaptive behaviors would be using phone in bathrooms, private places also. Facebook moms was one of the things that when the Facebook was very popular, so these were the moms, they forgot to feed their child, they forgot to bring their child from school. So the child is sitting in the school, like standing outside the school, and the mom is like busy on Facebook. So that was one of the concepts that was there before. porn addiction on work. Like we all read that, like, parliament means somebody is watching porn and something news comes to this. So porn addiction, and definitely you can get sacked out of your work because of it. Another issue is adolescence and the gaming issue. So as I discussed, they lose sleep, they don't get their meal, they have poor nutrition, they have disinterest in social life, they have outside world they don't want to do. So it's one of the hidden pandemic that's going on for adolescents and their internet use. So some of the personality traits that have been identified, of course, adolescent, the personality is yet to be developed, but some of the personality traits that are identified which are precursor or commented. So that's a crisis for these students or these people in general. Other thing is shyness, sensation-seeking behavior, loneliness. These are further linked to internet addiction. Okay. So a little bit, since I am a psychologist here, so a little bit about the psychology of internet use. Basically, the word that comes to mind is that these people, they actually were real world wala niche chala gaya. It was supposed to be there. So virtual world is what happens is that in virtual world, these students, habitual of saying students, these adolescent people, they avoid the real events or let's say the unpleasant feelings in the real world, and they escape them into the internet. So they have these, in gaming, they have these avatars, that's a virtual life, and these are the second life they have. They can create a character they want. They kind of indulge with these games. These games are very incentive based, like one sword and then the another golden sword and then the diamond sword and then some other sword that is passed from generation, like generation of warriors and everything. So they fight for these tools, and it's kind of a wish fulfillment so I can be a fat person, but in my virtual avatar or in the Facebook I trim the pictures and everything. I'm a very slim trim tall girl. So they use this as a wish fulfillment. Some statistics are there, but I think so I will more go to the intervention part. So intervention for internet addiction is more towards the moderation, like the same way you will treat a food addiction. It's like the same digital diet and digital nutrition. Like diet is the number of hours you spend on the internet, and nutrition is the content you click on. So we have been talking about cognitive behavior therapy here, although the previous speaker have already given some insight, but I can give you my insight as well. So CBT is where you focus upon the core beliefs and cognitive errors, the day-to-day thoughts that students are going through. So in behavior modification, what you do, you ask them to monitor the time, what they are going through. You prepare coping strategies, like what would you do? So dealing with boredom, that's what. You train them in mindfulness practices. Maybe we will also practice for 1 minute if we have. Cognitive restructuring is basically this next slide. Cognitive restructuring is their own belief system, like I am worthless in real life, nobody appreciates me, or I have some shame due to my body type or my facial features, so I don't want to accept that, and that makes me the worst person in the world, so everybody hates me. So you kind of challenge those cognitions, those core beliefs regarding self and how the others see me. The world does not care. My parents don't care about it. If I spend like 40 hours on the internet or per a week, it does not matter to them. So why not? And they get these recognition from the internet, so it's more fulfilling to them. So blaming, excusing, rationalizing, catastrophizing, minimizing that what's happened with the students here at my place, that it's not an important class. That class does not also have a class attendance monitoring, so I don't need to do that. And I'm just playing the game. I'm not taking drugs, I'm not taking cannabis. So in that way, they kind of rationalize and use these cognitive strategies in order to feel better with themselves, and then they use internet in a unhealthy way. So another kind of, this is an enhanced worksheet. They have a shut clinic there where they teach the sensible use of technology. So these are the worksheets that we work with. We develop insight into the like adolescents, like we try to develop an insight that why do you think so the change is needed, what you are ready to do with it, and kind of motivate and advise them, because they need these motivation, they need these reinforcement, and communication, the use of assertive communication, where we say that okay, you have come to the session, that itself means like you are motivated for change. So that's good in itself. And maybe if they say that they were having a strong urge to check their mobile, but they didn't do it, instead they go outside and talk to a real person outside. So like, wow, that means whatever we are talking about, that's helping you. So we kind of push them, reflect these things in a way that's kind of a reinforcing for them, that small changes that they are ready to make up, so that are actually contributing in real life. So some of the things that are written, some of things that could interfere with, it's like that's the another slide here. So that's the fourth phase, is relapse prevention, where we identify the external triggers and the internal triggers. The external triggers can be the time of the day, संडे है, क्या करना है, कहाँ जाना है, तो घर पे ही बैठे हैं, एक सीरीज़ ख़त्म हुई, दूसरी ख़त्म हुई, तीसरी ख़त्म हुई. So external events can be like that, and internal can be my own. Like मैं क्लास से आ गया, मैं थक गया हूँ, अब क्या करने को है, मैं बस I don't feel like that. And their inability to deal with boredom. Like slowness is something that they don't prefer. They would want some stimulation, one thing after another. So so any form of a boredom becomes an internal trigger. Their mood becomes an emotional stability becomes an internal trigger. So relapse prevention strategies, they talk about more of external and internal triggers. All right. And relaxation training is basically we also have to identify if the internet addiction or any form of behavioral addiction is secondary to any psychiatric illness. So in that, if it is secondary to depression or anxiety, then of course those things goes in cognitive restructuring and relaxation training, where they learn to calm down in stressful situations. Alright, so intervention summary is like you have to check your checking. Check your checking means like throughout how many times of a day we pick up our phone. Like we have this urge, and there is no notification in the phone. कुछ आया तो नहीं है, कोई mail तो नहीं आया है. Every morning we give it, अभी किसका WhatsApp आया है? And then sometimes what happens is when you pick up the phone and there is no notification, you feel bad. It's like nobody remembered me, किसी का कोई message ही नहीं आया सुबह से. So we have to be check your checking, and as a parent we have to model the behavior, because if we are using the devices so much, or we are ourselves dependent on devices so much, so our children learns that. So it's a dining table pay. It's like if a parent, any father or mother is using the phone, then I think so the child will also do the same, because then the equality doesn't stand there. So as a parent you have to model behavior, and at the same time when you are taking these devices from your children, what's left, they have free time. Now they please it is advised that these parents connect to their children, talk to them, sit with them, spend non-screen time with their student, and engage with them in any kind of activity, drawing, painting, playing outside, whatever, that kind of engages the students, the child, the meaning of a connection basically. So we have to disconnect from all the devices, maybe spending. So Dr. Kimberly Young, who has basically worked a lot on internet addiction, she advises 48 hours of screen detox, like no screen at all. So that kind of, she claims basically that if you spend these 48 hours, you will realize how much time you have, like how much time is there which you don't know, which is unnoticed, which is slipping by you into the device, and there is no record of it. Many of us, they don't record how much screen usage we have. So from screen smart, we have to become smart screen should convert to screen smart. All right. Regarding the futuristic approach, there can be more interventions in the school level that can be done. Screening tools for internet addiction can be done in the schools, and prevention in the early age is the same thing. Stress management, or like engaging the child, making the child engage into the activities which are not screen based. And then there is also some parenting guidelines that are suggested from age-wise. That again, these are given by Kimberly Young, and there is a whole manual around it. I've just summarized into some points here, like where she suggests like 0 to 3 years there should be a non-usage, which seems like an impossible thing because we are giving our child, a small child and an infant कि आप ABC वहीं से सीख लो. We are not telling them कि ABC वहाँ से सिखानी है. So anyway, but that's the guideline that has been given by a scientist who is working very hard in the field of internet addiction. So I think so that's from my side. Thank you so much. Thank you.
Thank you so much for a very interesting presentation. I had a few questions, but I think you've already covered most of them. So if we have time, we can have a few questions from the audience.
Our chairpersons. Dr. Kartikeya Sharma sir. Dr. Prabhat Singh. Dr. Kshitij Shrestha.